So, as I said, the committee was very interested in this notion of school-based health centers as a possible solution. Have any of you heard of school-based health centers? Okay. It's essentially what it is it's a doctor's office. It's a primary care office inside a school. And so generally there are 3 exam rooms, a laboratory, a waiting room, a bathroom. And so when you walk into the healthcare center, the school-based healthcare center, it's essentially you're almost leaving school and you're walking into a primary care office. Yes?
Would it be available for residents that didn't have school-age children?
That's a really good question, and that's one that our committee has talked a lot about. If it's built, it's going to be built with an outside door so that eventually that could happen, because there are school-based health centers in the state and across the country that do offer care to people from the community. However, in the very beginning, it wouldn't, just because they've got to figure out how this works and make it work well for the students. But yes, there's a possibility that down the line it could. The health centers are operated by a qualified health care provider, and in this instance, the Lake County Health Department has said that they are interested in, if everything works out, partnering with us with the committee to do this. Okay, and there are about 2,000 school-based health centers across the country, and in Illinois there's like a little over 60 school-based. So who provides the services? It's a multidisciplinary team of providers. There is a physician, usually either pediatrician, family practice physician, but they are not on site all the time. They're the overseer. They do the oversight. It's really a nurse-driven model, a nurse practitioner, or a physician assistant. All the school-based health centers have behavioral health people as well. And part of it you saw from the IYS data that mental health is a huge issue. And so that it's seamless in a way, because if the nurse practitioner identifies a problem, maybe a student comes in and says, oh, I have a stomachache. And then after talking to them, she realizes, yeah, it's not really a stomachache, it's because there were some issues at home. Then she or he can seamlessly walk them over to the behavioral health worker. You know, we've got somebody here who you can talk to. And so it's a very nice seamless. Important question, how will it be funded? Local tax dollars are not used to operate the school-based health center. It is in the school, but it is separate from the school. So school dollars are not used to operate the health center. They're funded by a variety of funding sources, including billing, which is really the primary way that they sustain themselves. So it's important to have a federally qualified health center which has enhanced reimbursement, such as Lake County Health Department. Private foundations, corporations, federal and state grants. Mostly the private foundation money, the corporate money, and the grant money supplements what can't be billed. So for example, mental health services get reimbursed at a very, very, very low rate. Health education, which is a part of this model. You know, we want to teach the students how to be healthy. We want to do proactive and anticipatory work so that we can address risk behaviors before they become vulnerable, That's not paid by any funding stream right now, health education. So that's where the grant dollars go. And as I said, they're operated within the schools, but they're administered with staffing funds independent of the school. And it doesn't take away from the educational mission, it actually enhances it. Who can use the services? All students are eligible. Enrollment in the school-based health center is not mandatory. It's encouraged, but it's not mandatory. So if parents don't want their children to enroll, they don't have to. To enroll and to use a school-based health center, a student must have assigned parental consent on file with the school-based health center. So again, if a parent doesn't want to sign the consent form, then we don't see the student except in an emergency. So for example, if a student is having difficulty breathing and is brought down to the health center and does not have a consent on file, the provider is not going to say, I'm not going to provide services. They will in fact do what they need to do in the emergency situation, meantime trying to reach the parents and then talk with the parents afterwards. That's the only case that they would actually see somebody who didn't have a parental consent form. And every effort is made to coordinate care with a student's primary care provider. So if you have a primary care provider, it can supplement, particularly in cases like asthma or other diseases where it's a good idea to have people collaborating together.
Question.
Sure.
Would this replace, work with, or have no effect on the current school nurse?
Really good question. It doesn't, it supplements it, it doesn't supplant it. And the same with the social workers. So for example, the coordinators on our team, so what would happen is there would be the same triage, that students would go to the health coordinator and the health office, and then they would triage. So if it's something, and I get that whole list of things that they could in fact provide, they'd go ahead and still provide them. But if it's something that they couldn't, then they would call and they would refer the student to the school-based health center. So it's essentially like they would do an outside provider, but it's right there.
Okay, thank you.
And the same with the mental health people. So menu of services, the Illinois Department of Human Services is a certification board for school-based health centers, and they have certain rules that school-based health centers have to abide by. And the requirements are that primary care, behavioral health, health education, and referral for oral health services are required. So, what are the services that have to be provided on site? Okay, and these are things that the school-based health center doesn't have a choice. These are things that if you want to run it and be certified by Illinois, you have to provide. And you can see physical exams, immunizations, diagnosis of minor illness and injury, management of chronic disease, reproductive health services, abstinence counseling, diagnosis and treatment of STIs, pregnancy testing, and cancer screening and education, basic lab tests, medication prescription, behavioral risk, and also mental health services and health ed. So these are non-negotiables. These are things that need to be done on site. Again, with parental consent forms. So if parents aren't comfortable with this, they don't have to sign their students up. Now, there are some services that the state recommends but does not require. And these are, in terms of their essentially reproductive health services, that you are not required to prescribe and dispense contraceptives on site, and you are not required to treat prenatal or postnatal, or provide pre or postnatal care. But you are required to refer off-site. So if somebody comes and you have decided, that you're not going to do it in your health center, you have to at least have a referral source. No decision has been made right now what the Round Lake area school district or school-based health center will do relative to whether or not they will provide services on site or not these services. That's under consideration. We're going around, we're talking to people, we're getting a lot of input. Any questions or anything so far?
What is the input you're getting so far on that particular question? Is it all over the place?
It's all over the place, to be honest, yeah. Interestingly enough, a lot of the parents that we've talked to are, we know this is a big problem. What we want is to make sure that there's health education that goes along with this. We don't want, contraceptives being given out willy-nilly without health education. And we also want education for ourselves. We want to know how to talk to our kids. That's what we're hearing. But I have to be honest that, there are some folks in the community that are very concerned about this. So we're hearing a lot of different things, and again, that's part of why we're going out and we're talking to folks. We want to be as transparent as possible so that there are 2,000 school-based health centers in the United States. Each one looks different because each one looks like the community. And so we want this to look like the Round Lake area. And so this needs to be what everybody is comfortable with, otherwise it won't work. And I'm not going to go through the benefits. It's a very beneficial model. It benefits the kids, it benefits the parents, it benefits the community. It actually saves money for the community. Hey, Jim, you seem to be smiling. I'm not sure. It's cost effective. It decreases hospitalization and reduces emergency room visits, and it saves the district money by decreasing absenteeism. You know, every time kids aren't in school, the district loses money. And also less lost time for parents and guardians in terms of job time, losing time, taking time off of jobs. This is just to show you that all of the things that the health coordinator said she had to refer kids out for could be provided on site, with the exception of the dental care. There's a decision that's been made that putting operatories inside of primary care offices is wildly expensive, and so the Lake County Health Department has dental offices, new dental offices, and they've agreed to actually have certain days that would be for Round Lake area students, and maybe figure out ways to get students there. And this is just the planning process. We've gone through an extensive planning process, and again, right now we're still in the planning stage. And I'm not going to go through all this because we've talked about this, but I do want to go through this. And these are the assumptions that our group has in terms of moving forward. And I think these are important to share these. As I said earlier, local tax dollars will not be used to operate the school-based health center. Students will only be seen if they have signed parental consent forms. Creation of the school-based health center is dependent on securing adequate funding for build-out and operation. So if we don't have dollars, we're not going to do it. So if we can't get grant dollars, and if the Lake County Health Department cannot do a business plan that shows that it's going to be break even, then we're not going to move forward. It's anticipated that the earliest the school-based health center would open would be 2013 to 2014, and probably it looks more realistic 2014, and I'll explain why in a minute. It will, and this answers your, Trustee Duberstein, your question about the community. It will grow slowly and intentionally. With time, we can expand to the elementary school and then expand to the community. And it will be operated as a collaborative of key stakeholders supporting the effort. And we've got NACASA, who said they'll do substance abuse services. Vista, who said they'd help with mental health services. We have Advocate Condell, who said they'd help with health education. So we've got a lot of partners who said they will step to the table in mano a mano who will help with health outreach. Okay. And these are just some of the questions that we've heard from the community, but I think we've talked about a lot of these. And this is just some testimonials of people, of a principal, of a parent, and a student who have used this and how it's changed their lives. So, any questions?
What's your gut feeling about the funding?
Okay, and thanks for asking me, because I'm very optimistic, because actually, HRSA has, there's a, whoa. We talk about money and the lights come on. There is a federal grant, actually, that's out specifically for school-based health centers for capital money. And the Lake County Health Department is going to apply for that. It's $500,000 per site for funding, which would totally cover not only the build-out, but would cover equipment. And I think we've got a really good shot for that. And in terms of, because the Lake County Health Department is a federally qualified health center, and because so many of the students are on Medicaid, I think it will be a good business model in terms of being sustainable. one other quick thing I want to add, and then I'm done, is that in terms of some of the people have been concerned that the high school's so crowded, this would be at the high school, and what the district has decided, they've been working with their own architect of record on talking about their own master building plan. This would be not part of the, it would be built outside of the school, so it wouldn't take away any existing space. And again, if the grant is awarded, everything, then the architect